Most people think tick season starts in July, maybe August if you're camping in the woods somewhere. It doesn't. In Indiana, Illinois, and Michigan, ticks become active the moment the temperatures hit 45 degrees. And that's now. Sometimes even earlier in the southern Illinois area. And this year, after a mild winter across the whole region, tick populations are higher than usual. And they're out earlier. So if you spend any time outdoors, in your yard, on a trail, walking your dog in tall grass, now is the time to know what you're dealing with. These ticks cause most of the problems in the Midwest. Deer ticks, also called black-legged ticks. They carry Lyme disease. Dog ticks carry Rocky Mountain spotted fever. And the Lone Star ticks, which are spreading fast through Indiana, Illinois right now, cause ehrlichiosis. One bite from a Lone Star tick can even trigger a serious allergy to red meat. Yeah, really, it can do that. Here's the part that catches the most people off guard. You usually won't feel a tick bite. They're tiny, sometimes the size of a poppy seed, and their saliva has a mild numbing effect. Sometimes, by the time you find one, it may have been attached for hours. Here's what most people don't know. The risk of getting Lyme disease from a tick bite is not immediate. It takes time, usually 24 hours or more of the tick being attached or embedded for the bacteria to actually get transmitted. And that window matters a lot. If you find a tick and remove it quickly, your risk drops significantly. Here's how to do it right. Use some fine-tipped tweezers, not your fingers, not petroleum jelly, and not heat. Grip the tick as close to the skin as possible and pull straight out. No twisting. Clean the area after you're done with soap or water and rubbing alcohol. After removal, save the tick if you can. Seal it in a plastic bag with a damp paper towel. Some health departments will test it, and it gives your doctor useful information. Now, if that tick was attached for more than 24 hours, or you honestly don't know how long it was there, there's something you can do about it. A single dose of doxycycline taken within 72 hours of removal can prevent Lyme disease from developing. It's called prophylaxis. It's not always necessary, but in the right situation, it's the right call. So you remove the tick. Maybe you got some prophylactic treatment. Now you're watching and waiting. Here's what you're watching for when it comes to infection. The most recognized sign of Lyme disease is a bullseye rash. That's a red ring expanding outward from the bite site. It shows up in about 70 to 80% of Lyme cases, anywhere from 3 to 3 days after the bite. But not everyone gets the rash. Some people just feel like they have the flu. Fevers, chills, fatigue, muscle aches, and joint pain. And then there's Rocky Mountain spotted fever. It moves faster. Fever, headache, and a spotted rash that usually starts on the wrist and ankles. That one can get very serious very quick. Don't wait it out. And then there's ehrlichiosis, from the Lone Star tick that shows up with fevers, headaches, and GI symptoms, sometimes with a rash, sometimes without. The general rule is to monitor yourself for 30 days after a tick bite. If anything shows up, get evaluated. Don't assume it'll pass on its own.